everyone, my name is Olivia Brennan, and today I'll be talking about Mille County, Minnesota. I'm also enrolled in PH 541, so we'll be talking both about the Community Health Assessment as well as the Community Health Improvement Plan. Okay, and then next we will be just doing a little overview of my presentation. So first I'm going to talk a little bit about the background of Mille County, as well as just a little bit on some of the demographic information from Mille County. And then next I'll be talking about areas of improvement overall. So that's looking more at the community health assessment there. And then I'll be diving a little bit deeper into my areas of focus. So you'll see that a little bit later in the presentation, but I'll be touching more on mental health as well as childhood health and obesity. And then with those two, I'll be talking about programs to either implement or improve. And then that's going to be looking more at the community health improvement plan with that. All right, so now we're just going to touch a little bit on some of the background in Mille County. So in case you don't know where that is, it's shown here on the map, this little red highlighted region. It's more central to Minnesota, but also is a little bit more towards the eastern border where Wisconsin is. So Mille County overall has a population of 26,867 people. And then 70.8% of those people live in a low population density area. Basically just means about 70% of the population lives in a rural area. And so if we're looking a little bit more at specific age demographics, we can see that 23.5% of the population is under the age of 18. And then 18.2% of the population is over the age of 65. And then the last thing I want to touch on here, super important, is that Mille County is ranked number 84 in the healthiest counties in Minnesota. And then something to keep in mind with this is that there's only 87 counties in Minnesota. So being number 84 shows that there's a lot of room for improvement. We'll see here in just a moment that there is a wide range of public health needs because of this. So now looking at the areas of improvement, I took data from both the Community Health Assessment from 2022, which is the most recent report on that, and the Community Health Improvement Plan from 2023 to 2027, which is the plan that we're currently in right now. So if we're looking at the Community Health Assessment, we can see that our areas for improvement are split into primary health needs and secondary health needs. So some of those primary health needs are mental health and elderly health. And then some of those secondary health needs are substance abuse, obesity, and access to health care. And then if we're looking at the Community Health Improvement Plan, some of the areas of improvement that they noted there, specifically 11 of them that they chose, were dental care for uninsured, and then this also goes for people who are just underinsured, since we know that a lot of healthcare places don't necessarily cover dental and vision with that. And then affordable childcare, poor physical health / obesity, teen pregnancies, food insecurity, transportation, since there's no form of public transportation in Mille County, substance use / abuse, livable wages, affordable housing services, and then with that, just overall poverty prevention, and then mental health and healthcare access. And so we can see from both of these sets of data that there is a bit of overlap. So looking at this, we can see that there is a wide range of public health needs. So now to talk a little bit more about my specific areas of focus, we are first going to touch on mental health in Mille County. So for this, I have taken some data from the Community Health Assessment to just go over kind of where they're at. So first, there's an average of 4.6 poor mental health days within a 30-day period. And then this was taken from 2020 data. And we can see here on the map on the right, kind of in that center region where Mille County is that they are kind of in that mid-range. So not like the darkest shade of green, but also not the lightest. So better than some counties, but there's still definitely room for improvement there. And then next, we can see that 15% of the population in Mille Lacs County experiences mental distress compared to 12% of Minnesota residents. And this data was taken from 2021. So that county average is just slightly higher than that state level average. And then next, from that community health assessment, depression and anxiety were the most commonly reported mental health disorders among children and young adults. And then depression, loneliness, dementia, and Alzheimer's disease were the most commonly reported mental health disorders for adults and older adults. And then looking a little more specific here, we have an average of 25 suicides per 100,000 people in Mille Lacs County and 13 suicides per 100,000 people in the US. So looking at this, we can see that that county level data compared to the national level data is nearly doubled than the national average. And this is looking at data from 2016 to 2020. So just an important thing to note about this here is that this specific data, and really anything else from the list too, might be slightly different now post COVID-19. So this was all taken from 2021 or earlier, but these statistics could look a lot different now, and honestly, probably a lot worse now. And so then also from the community health assessment noted were some barriers for specifically low-income residents, children, and elderly people. So one thing here is that there is no public transportation, as I mentioned before, in Mille Lacs County. So being able to get to any mental health resources, since they're kind of sparsely located, geographically speaking, that can be difficult to just find resources in the first place. Then on top of that, trying to find time to take time off of work or school and then being able to afford it, since we know it's not necessarily just like a one and done sort of thing. You have to go for an extended period of time as well as go for multiple sessions. So looking here at some improvements for mental health for Mille Lacs County, looking at some of the things that were mentioned in the Community Health Improvement Plan, accessibility and knowledge of mental health resources would greatly improve mental health outcomes. So in Mille Lacs County, there's a 390 to 1 ratio for mental health providers. And that basically means that there's one mental health provider for every 390 people. And then if we're comparing this to like statewide and national level ratios, it's usually about like 340, so about 50 less there. And then just looking at some of the healthcare providers for mental health resources in Mille Lacs County, there's about 32 options there. And they definitely have a good range for resources that will help adults and specifically veterans. However, there is more need for childhood mental health resources. So one thing that I think would be a good idea is improving mental health in schools, since there is kind of a lack of mental health resources for children, as well as there was reported concern for that. So improving mental health in schools would be a good way to help children out with that. So one area to improve here could be improving students' mental health literacy. So by that, just basically having a thorough, well-rounded educational curriculum on mental health and the different signs and ways that you can get help, things like that, and mostly just to implement that into current health curriculums for students. And then another thing would be to focus on mental health equity. So basically just making sure that there are either provided resources within the school or letting kids know about resources outside of the school for specific groups who may be struggling extra hard with their mental health. So that could be LGBTQ plus community, non-white students, or low-income students. So basically just making sure that they have resources that meet their specific needs. And then last, I think that implementing more counseling and stress management programs for students would be a great way to improve mental health. Specifically with stress management, as we know, high school can be a very stressful time. There are academic expectations, work expectations, social expectations, as well as, trying to figure out the rest of your life, applying for college. A lot of that can be very stressful. And so making sure that there's more counseling and stress management, as well as fostering a really healthy and open and safe relationship between staff and their students. Overall, this would be best to improve childhood mental health. So next we're going to look at childhood health and obesity. So from that 2020 community health assessment, we can see that 1 out of 3 adults in Mille Lacs County are obese. And then with that, only 46% of the county lives within a half mile from a park or recreational facility. And then looking at the nutrition aspect, some of the most common factors that were reported were lack of healthy foods within grocery stores, restaurants, and just lack of grocery stores overall, as well as affording healthy foods. So if we're looking here at improvements for childhood health and obesity, the two main things that were mentioned in the community health improvement plan were 1, physical activity, and 2, healthy eating. So if we're looking at those two factors, I suggest maybe doing it from a more preventative measure. So I think that preventative measures in childhood to combat obesity through physical activity and healthy eating would improve physical health outcomes for Mille Lacs County overall. So this is another area where the school setting can help combat this issue. So one thing here is healthy meal incentive grants. So these are from the USDA that basically give grants of up to $150,000 to rural or small town schools. And then this money can be used to help improve their school lunches and breakfasts and make them more nutritious and well-rounded so that children can be having their proper nutrition throughout the day, especially if some kids maybe don't necessarily get that from home. And then another thing here is school gardens. So school gardens are a great way for not only the kids to just have fun, but it also would work well with the rural settings of a lot of these schools. They'd have the best landscape to be doing that. So school gardens could be a great way for children to learn about growing their own produce, as well as implementing it into their diets through different recipes. And with this, we could even implement like taste testing days for the produce, and that way the entire community could get involved. And then last thing here is partnerships with local recreational facilities. So for example, I remember from my own elementary school, we would partner with the YMCA and set aside time for all the kids to go swimming and stuff like that. And then I know that they also have like free memberships for students and things like that. So working out partnerships with other local recreational facilities would be a great way to incentivize kids to be physically active. And whether that's within the school setting or outside the school setting, it's a great way for kids to get more physical activity. So here are my sources that I use. Thank you all for listening, and I hope you learned a little bit more about Mille Lacs County and their community's health.